Good morning everyone. After discussions the Sūryabhedana Prāṇāyāma on cardiovascular system as well as autonomic nervous system, let us understand Sūryabhedana Prāṇāyāma on respiratory system, how respiratory physiology is altered by practicing of Sūryabhedana Prāṇāyāma. This Sūryabhedana Prāṇāyāma helps in or increase in cellular respiration. The respiration in cellular level, it increases. How does it happen? Please understand this. For example, this is the lungs. This is lungs and this is the our stomach, GIT tract. How it will happen? The air will comes to our lungs. Which air? Oxygenated air. It may not be oxygenated only, but I am talking about the partial pressure of oxygen will be more. The oxygen will be more in the atmosphere. So higher pressure to lower pressure, it will move. Means higher side to lower side. Inside the lungs, you have the more CO2. So less O2 is there inside the lungs. So higher concentration, lower concentration, it will move. O2 will move towards lung side. In the same way, CO2 will go out of your lungs because CO2 inside the lungs or in your body is more. So partial pressure of the CO2 more in the lungs. So it will go out. So let's focus here. What I am talking here, the partial pressure of oxygen will be more in the atmosphere. So it will get into the lungs. From lungs, it will come to the, this is for example, bloodstream. This is bloodstream, blood. After doing many kind of exchange, the oxygen will come to the blood. Now in the blood, there is a oxygen, not only oxygen. I am talking about the partial pressure is the oxygen. Wherever I am using the oxygen word, you should understand this is all about the partial pressure. So oxygen will be more in the blood. It will bind with the RBC and so. RBC also obviously it is made of hemoglobin. So it will bind with the hemes and many things are there. Just understand oxygen get into the bloodstream. Now glucose, how you will get? We will be having some roti, chapati and all other things that will come to the stomach. It will break down in the stomach. So at the end it will form as glucose. That glucose is come to the bloodstream. Right now in blood there are glucose. How does it come? Glucose from your digestive system. Whatever we have, roti, chapati, idli, dosa, whatever, it will break down into small particles and the glucose will be the finest particle of carbs that will go to the bloodstream. Right now in blood we have the glucose C6H12O6 plus we have the O2. So oxygen from the respiratory system and from digestive system there is a glucose. They will bind together. They will bind together and they will produce one particular energy called as the ATP, adrenotriphosphate, ATP. And in the process they will remove one waste product. The waste product itself called as the CO2 as well as H2O, water. CO2 and H2O. This is the waste product that has to be thrown out from your body. Okay, and this CO2 will go as a part of deoxygenated blood, means by expirations, by exhalations. And some part of water will be absorbed in your body throughout your body parts, and some part of water will go out by sweating, by urination and so on. So what I am talking here is cellular respiration, nothing but whatever you are inhaling in the terms of Sūryabhedana Prāṇāyāma, you are inhaling long, deep inhalation through right. So that inhalation, what will happen? That oxygenated air, means the O2 will bind with your glucose. When these two will bind, they will form energy, which is essential for the cell growth. All these things will happen in the mitochondria. That's why mitochondria called as the powerhouse. So ATP is formed, means energy will form, means that will be utilized by the cells. Some XYZ cell is there, any kind of sites. Any sites you take, any cells, that will be utilized. And in that process, the CO2 and water will be released as a waste. So that CO2 will go by exhalations and O2 also H2O, water also go by urinations, defecations, sweating, and some part of water will be absorbed in your body parts. So this is called as the cellular respiration. Why this thing essential? To produce ATP. So if you inhale more and more, what you are doing? You are inducing more oxygen. And glucose will be there from your food, whatever you eat, so that at the end of the day you will be enriching the energy to do work. That's why If you not have the food, you won't get energy. If you do not breathe properly, you cannot, you won't be energized. The person who eat more, if you teach him more pranayama, means deep inhalation or deep exhalations, so there is a chance he may produce more energy. Fat may not be there. If that energy is not able to produce, if that is there any problem regarding the metabolism, this energy itself going to as a part of store energy, as the store energy, or called as the fat. It may be deposited on different parts of your body if your metabolism is weak. To induce the metabolism, this is a good practice. Which one? Sūryabhedana practice. It will make your body heat, and heat is the very good for the mechanical process, the cutting or the absorptions, assimilations, and so on, digestion also. So this is the first point regarding us, why deep breathings means Sūryabhedana, active breathing is essential to produce energy, and at the end your body needs energy to do any kind of activation, any kind of work, function. Okay, so this is about the first point. Okay, hope you understood this point. Let us understand the point number 2. The deep inhalations increases the tidal volume. Normal tidal volume is 500 ml. What is tidal volume? Tidal volume is the volume which is present in your trachea tract or your trachea tree when you are in a normal state. It will be present all the time, tidal volume, and it helps in obstructive disorder. Obstructive means like COPD may be there, or it may be asthma, emphysis, and so on. All kind of creates the obstruction. If you inhale fully, I am talking the deep inhalations. In Sūryabhedana we are doing deep inhalation. I am not talking the advanced level of Sūryabhedana, which includes different types of ratio, 1:4:2, and so I am not talking about that. Normally, for a patient who cannot hold, who cannot do bandha, for him the normal deep inhalation, deep exhalation, I am talking that it will increase the lung capacity, the vital capacity, or lung total capacity, or lung volume, or also tidal volume. How it is? When your lung is getting enlarged with more inhalations, the intercostal muscles between these ribs cages and the diaphragm, they will be enlarged, expand more. When you inhale fully, diaphragm goes up. When you exhale fully, diaphragm getting relaxed. So what I am doing? I am doing some kind of exercise so that my respiratory muscle will be elasticity. Elasticity will get enhanced, increased by the deep inhalation, deep exhalations. Here also, if you see the person is inhaling, exhaling means it is getting expanded. When the person is exhaling out, the whole chest cage, rib cage getting contracted, getting small. Again, if you are inhaling means getting enlarged. By that, what we are doing? We are making the strengthening the rib cages, total respiratory system. It may be lungs, it may be the alveoli. They are getting more elasticite. They are getting flexible. If any situations come, they can breathe properly. For example, if you are stressed out, your breathing gets slowed down. If you look suddenly some kind of horror situation, or some kind of some situation like you met an accident suddenly, your heart rate will go up, but you cannot breathe properly. To maintain the proper heart rate, you have to breathe properly. But in that situation, you cannot breathe properly. To maintain that, if you already practice deep inhalation, deep exhalation, up to some extent you can tolerate. If you see any sports person, athletic persons, okay, our normal breathing rate will be ideal is 72 times. Our heart rate 72 times. Okay, and our breathing rate will be respiratory rate. This is called the heart rates per minute, heartbeats per minute. It's actually, and our breathing rate will be 13 to 14 times per minute. But if you meet some situation which is odd situations, your all sympathetic domain get activated. You met an accident, heart rate will go up. It may not be 72. It may reach up to 130 also per minute, per beats. Or this respiratory system not 13, 14. It may goes to the 20. But in this crisis, your breathing may not be there active. It will remain as 13 to 14 only. But to make more cardiac output, you need to breathe properly. How do you do that? If you not train your body such, how athletes are not trained, then there is no options. He may develop heart attack, or he may go for the tachyarrhythmias. But if you practice already these things, any situation comes, you can fight that things. That only I am talking here. Any kind of obstructive disease, maybe COPD, and also the lung or the trachea tree, that this trachea will be enlarged, so easily air can go and come out freely. The obstruction will not be any problem for that particular person. Obstruction may be due to anything, some kind of infection maybe in the lungs, or some kind of, you can take the pulmonary edema or any other issue. So by the practice of deep inhalation and deep exhalations, that will increase. Which will increase the elasticity of the respiratory muscles, or inhalation exhalation amount will increase. The prana, the amount of volume of air will increase, so that the person can help. It will help to overcome the obstructive issue. When we will discuss regarding the pathophysiology, we will be talking regarding the obstructive disorder, restrictive disorder deeply. Okay, hope this point is clear for you, why it is essential for such guys. Next, this pranayama itself helps to retention cause for the partial pressure of carbon dioxide. It will help to increase, say mild rise, not too much. When you inhale fully, this picture shows opposite to that. Like here, the decrease of the partial pressure of carbon dioxide and increase of this. But I am talking the ulta of that, opposite to that. What I am talking here is, if you inhale fully, retain the breath properly, means kumbhaka. In case of patient, in case of patient, heart patient or COPD patient, they should not do anta kumbhaka, means by inhaling you should not hold, because the carbon dioxide will be more in their body. It is not so good for those patients. If you are a normal guy, healthy guy, want to develop your skill, or you want to develop your good health, then it's okay. That's why in case of yoga therapy, we should not reveal, we should not teach the patient about the anta kumbhaka, where there is a more collection of CO2 inside the body. We helps to do bahi kumbhaka, the bahya kumbhaka, which is carbon dioxide releasing. Okay, so in patient we should not apply kumbhaka, we should not do mudra bandha. Normally you can perform. In case of this practice, the deep holding means the kumbhaka. If you hold properly, inhale and holding means CO2 level will go up in your body. I am talking about the CO2 means partial pressure of carbon dioxide will be more in your body. What will happen? It will go to the bloodstream. Okay, and obviously it will create some problem regarding the cellular respiration, because cells already utilize oxygen and they are releasing the CO2. They already releasing means again excess CO2 will be there in your body. That may go to the any other different parts of your body. It may go to your respiratory centers in your body, in the pons area, through the pons. It may go to that. If it reaches there, your hypothalamus will be trained to adopt the odd situations. If there is any odd situation comes, like a fight and flight movement, your body will be able to tolerate. If there is any air pollution is there, you want to stop your nose, you want to close your nose, and you can pass. It may take 1 minute to pass that garbage area or that polluted area. So you can tolerate by having that breath. So what you will do, it will also indirectly using, or indirectly it is increasing your lung capacity. Lung capacity. That's why if you breathe properly, like normal anta kumbhaka, your capacity to hold the breath will increase. Again I am telling, this picture showing something different. Here the increasement of carbon dioxide, CO2, and decreasement of CO2. I am talking here anta kumbhaka, retention, which will increase your CO2 inside the body, which is not necessary. At the initial state for a long things. For example, you are going for a trekking, Himalayan or some other places where you need more oxygen, because oxygen will be less if you go up. But if you train your body in such by practicing pranayama and other things, what you will do, if you go up without having much more oxygen, you can tolerate with CO2 itself, because your body, intercostal muscle, sternum or whole rib cage is habituated to that. That's why yoga says it's not one day game, it takes little long time. 1 day, 2 day it won't work. It takes little long time to get into practice. Okay, that's why I hope you know, many yogis, the Naga sadhu, without having any food, only by breath itself, they will to control their mind, they will to do their sadhana. Means here, see, if you come to the first point, I'm talking here the essential thing is glucose and plus oxygen. Glucose plus oxygen is essential. By in yogi, they won't have food. They may not have the food. By glucose itself, and from their body there is a store fat. The muscle fat will be there. That only useful for their energy production. But for a layman, for a family person, we have to have the food. 3 times we have the food. But in case of yogi, what Grand Samhita explains, yogyam yogi bhojanam doyam acharet. The eligible food, good food, pathya food, the yogi should have twice. Okay, so the food will come from this side and oxygen from that side for a layman. For a yogi, food is the negligible part. They won't bother. Their whole energy for the sadhana. How much is essential for their body, that much only they will have. Called alpahari, mitahari. That. So that glucose can produce the energy by having proper breathing practice. Means pranayama and so. So what I am talking about the retention, the kumbhaka of any kind of pranayama, mainly Sūryabhedana Prāṇāyāma, in case of patient. Without patient, if you are not a patient, don't focus here. In patient, we should not do retention. If you are a normal man, you should do kumbhaka. So while doing kumbhaka, what you will do? You are increasing the partial pressure of CO2. That CO2 will go to the different parts of your body. Eventually it goes to your respiratory center in your hypothalamus. And it will give some negative signal, which is not so good for the brain. But brain will be habituated to that. If you practice anything right or wrongly, you will get the habit for that. So brain will be habituated to face some such situations. If you next time if you visit some situations, like as I told, trekking or some situation come easily where the oxygen is not supply is not sufficient. If you go to trekking, if you go to Himalaya and all, the oxygen will not be sufficient, but still your lungs, your body will be manage that state by having CO2 itself. That's why in 3rd chapter Yoga Sutra already explained different kinds of vibhutis. How you will get the vibhuti? You can get the mastery over the prana also, samana also. Many explanations are there. Hope these 3 points is clear with you. These 3 points connected to the respiratory system by the practice of Sūryabhedana Prāṇāyāma. After completion of Sūryabhedana Prāṇāyāma on respiratory physiology, let's talk Sūryabhedana on thermogenic as well as metabolic. Remember, thermogenic means which is regarding the temperature, and metabolic means regarding the digestion, assimilation, the whole process of digestion, utilization of the whole things. What I am giving explanation here is this pranayama, obviously it increases the sympathetic outflow. We know how it will increase from previous slides. So we have discussed already in terms of autonomic as well as cardiovascular system in that part. Sympathetic outflow will increase when it will pass through the nasal mucosa, respiratory mucosa. It will activate the 5th cranial nerve. Okay, then it will go to the hypothalamus, and from there itself the sympathetic domain will get out. That will be activated, and which will release the adrenaline and non-adrenaline, or epinephrine or non-epinephrine by activating what? Renin, angiotensin, aldosterone system. Renin, this is renin, angio, angiotensin, aldosterone system. Some books mention renin, angiotensin, aldosterone axis also. The whole axis, like we know the gut microbiota axis or HP axis, many things are Same way, renin, angiotensin, aldosterone system. Let's understand this, how it will happen. This is our brain. For example, this is our brain. Okay, this is your brain. Just for your understanding about, this is our brain. Now see, this is our heart. Please understand this. Try to understand quickly. I will go a little fast. This is the heart muscles, cardiac muscles. See here, by inhalations, what we did, the sympathetic activation already started here. Through this, the outflow will take place through the descending pathway, and it will work on the SA node. SA node already having the beta 1 adrenergic receptors. We know that. Now after that, what will happen? The heart will be contracting more, many ways. The heart contraction will start. I am not going detail into that. You already know that. the heart contraction will start. If the heart getting more contracted and more depolarized, contraction start, then automatically what will happen? There is a liver present here. Liver. There is a part of liver. We know this. Liver. This is. And there is a kidney. There is a kidney. Also, kidney is there. Okay. Now, kidney release one kind of chemicals called as, I am not writing fully, renin. R-E-N-I-N. Renin. Okay. Which will make something contracted. Which is squeeze these things. Now, renin will be released from the kidney. The renin will go to bloodstream. Okay, and here also the liver will release one kind of enzyme called as the angiotensinogen. Angiotensinogen, which is inactive protein. Angiotensinogen, it's a kind of protein. Angiotensinogen. This angiotensin will come from the liver, that will bind with this renin, which is coming from the kidney, nephron obviously. So the renin and angiotensinogen, it will bind together and they will form angiotensin 1. Okay, angiotensin 1. Again focus what I am talking here. The liver will release kind of inactive protein called as angiotensinogen. Okay, and renin will come from the nephron, obviously kidney. They will bind together and they will form angiotensin 1. Okay, angiotensin 1. This angiotensin 1 will go to the, by the flowing of the blood, it will go into heart. From their heart it will pump. Again it will go towards this. There will be lungs, will be there, lungs up. Then this blood will go to the lungs for the purifications. Because this is CO2 blood, isn't it? Why it is CO2 blood? Because it is coming after use of cellular respirations. Please understand. After using of cellular respiration, the CO2 blood is doing all these things. The deoxygenated blood. So deoxygenated blood is go to the lungs for the oxygenations. In the lungs, there is some kind of enzyme is also present. Called as the ACE, angiotensin converting enzymes. ACE, angiotensin converting enzyme. So this will bind with angiotensin 1. Angiotensin 1 plus ACE. If they bind, this angiotensin 1 will be converted into angiotensin 2, which is a active protein. Now it is having the total 8 octapeptide. This is called the octapeptides, 8 amino acid chain. And here angiotensin 1 is a decapeptide. 10 amino acid chains are there. Here is a 8. So it's called octapeptides. Which one? Angiotensin 2. Okay, angiotensin 2. Now this angiotensin will come to through the blood. It will go to the again heart. From heart it will go to the different parts of your body. Now when this blood is contain angiotensin 2, it's a very strong contractor or vasoconstrictor. The veins as well as artery will be constricted more. When in the blood there is angiotensin 2 is present. Now how angiotensin 2 is present, we know. It got converted from ACE in the microcirculation in your lungs. ACE, microcirculation in your lungs. And in the lungs, it was there before binding angiotensin 1, which is 10 amino acid, called as the 10 amino acid. It is a inactive protein. After becoming 8, after becoming angiotensin 2, it's become the active protein, octapeptide. Before it was deca. So after forming angiotensin 2 in the blood, it will go to the liver, it will go to the nephron, and it will go to the different parts of arteries and veins and so. If it goes to the nephron, kidney, it will bind with its receptors. In the kidney there is a kidney medulla. Kidney medulla is there. Okay. Kidney medulla will be there. They are called as the, yes, kidney medulla will be there. It will bind with this particular, which one binds? angiotensin 2 binds. Then this will make some orchestra and it will release non-epinephrine or the epinephrine, adrenaline or non-adrenaline it will release. And this, if release, means it is a very strong vasoconstrictor. If the vessels are all this thing getting constricted, then what will happen? Your body will be more stress. Your body will be more tense. That's why we say Sūryabhedana Prāṇāyāma should not be taught more stressed people, more tension people, more anxious people. You should not teach that. Why? They already having the overactivation of sympathetic outflow, overactivation. Again, if you give the more overactive flow, mean over stimulation to the sympathetic flow, means they will be hyper, very hyper, which is not good for them. Again, understand this physiology. What I discussed, these whole things call about the renin, angiotensin, aldosterone system. Renin means which is released from the kidney, renin. Angiotensin means which is converted into 1 to 2. Aldosterone means the aldosterone or the adrenaline will be releasing here, and that they are very bad for the stress releaser. So adrenaline is hormone called as the stress inducing hormone. Non-adrenaline also same. Epinephrine, non-epinephrine also same things. And once they release from here, from this blood, from here, from juxtaglottal apparatus, they can work on brain centers also. So it will induce again the sympathetic activity. So continuously it will be on a kind of cycle. So the person will be always in stress. That's why we say Sūryabhedana Prāṇāyāma should not be taught to stress and anxious people. They are already having the stress, anxiety or anxiousness. They should not it should not make it more and more. We should decrease that. So we should teach something else. Hope this physiology is clear to you. There are many things to deeply understand, but I mentioned this. This practice will make this sympathetic outflow is overactive. I am talking the physiology of this pranayama on different parameters. Okay. Same thing. Second point is called increased basal metabolic rate, BMR. The BMR will be increased. How it will increase? When the cellular respiration already done, cell already utilize the particular cell will utilize the oxygen. So oxygen is coming in. After utilizing the oxygen and glucose, all these things, cell will be charged up and that will release the CO2. CO2 will be releasing out. So cells are very much active to do its function. So cells are overactive. The metabolic demand, and they need more food. Why they need more food? Because oxygen supply is there by inhaling more, but the glucose supply should be there. Glucose supply must be there. To supply the glucose, you will feel more hungry. If you do not eat the food, if you not taken the food, the oxygen supply will be there. So you utilize that oxygen will be utilized the store fat. That's why the people who does not eat food after 1 week, 10 months, like some person go for the fasting, for 1 week fasting, continuous, some kind of strike, Anna Hajara, you know those. So if you go your automatic weight gets decreased. Why? Store fat will be utilized. How? Because you won't stop to breathe. Breath will be continuous. In case of this pranayama, you will be inhaling, exhaling more. So more oxygen will come to your body by doing more deep inhalations. So body need more glucose, but you are not having food. So it will use your store fat. So your weight will decrease. This is a good sign for a obesity people. Okay, which is called as this line itself. Long-term practice leads to energy, fat or lipid metabolism. If you inhale fully you are inhaling and exhaling fully, the oxygen is coming and CO2 is going out. But the oxygen should utilize glucose. If you are not having food, if you are obese, you no need to have much more food. Whatever glucose you are having, that will be utilized. So that's how it works on the lipid metabolism. In case of this metabolic rate, what I am talking here, the person who is having less food, if you do not eat the food, but he is not obese. The person is not obese. Normally, he is a healthy guy. Its BMI is under control. Obesity is under control. But he will not even good food. Then he will feel more to eat. How he will feel to eat more? Because cells, they need more glucose. They should use their oxygen, isn't it? The person does not have any fat inside the body. So how it will use? If you have the feeling of craving of eating more will be there. From there again, message will go to the hypothalamus, thirst and food center, and hypothalamus will release some kind of chemical, okay, gastrin, which called as gastrin in the stomach. So stomach will release the gastrin and you will feel to eat more. Gastrin is a kind of what to call hormone itself. So the person will start to eat more because BMR is more, the metabolic demand. Why the demand is going up? Due to the over activation of oxygenations by practice of Sūryabhedana Prāṇāyāma. So person will feel to eat more glucose in terms of rice, chapati and so. Hope you understood this point. These 2 points are correlated, these 2 points. Now the other point is production of the heat, a fight against the infections. This practice also helps, said like, it is a call as the, this practice helps to overcome the krimi dosha. The krimis are mainly worms, intestinal worms or external worms or kind of microbes. They are very bad for your health. If this practice producing heat, I am talking the heat means not the, if you touch your skin you will feel heat, no. But if you take continuous practice, if you test by thermometer, you will feel this practice leads to little heat. How it leads to heat production? Due to this mechanical changes. Cellular respiration goes up. The heart rate goes up. The contractility of the heart, contraction of the heart or the myocardial contraction is go up. Eventually cardiac output goes up. All kind of mechanical events, even the inhalation, exhalation, that also goes up. So body always in the active state, plus the sympathetic function, sympathetic outflow will be up. So all these events leads to induce the sympathetic outflow as well as the activation, and at the end BMR also go up. The basal metabolic demand also goes up. The metabolism is the demand of the metabolism. That means what is the demand? The glucose and oxygen is the basic demand for a metabolism. That's it called as the basal metabolic rate. This demand goes up while you are doing more inhalation, exhalation. So in case of this inhalation, exhalation, by production of the heat, by doing all such activities, the cardiovascular activity, then heart rate, the cardiac output, all those things, the heat generator means it is very bad weather or bad environment for the formation of the any kind of infection or worms. So infection of worms will not be remain in your body, it will vanish. So that's the way to overcome this particular problem. Hope this metabolic physiology as well as thermogenic physiology is clear in terms of Sūryabhedana Prāṇāyāma. So after understanding the thermogenic as well as metabolic effects of Sūryabhedana Prāṇāyāma, let's understand the effect of Sūryabhedana Prāṇāyāma on neuroendocrine physiology. How does it work on neuro as well as endocrine? As we know, the person will breathe from the right nostril and that breath will go to the nasal mucosa. From nasal mucosa to it will get into the brain through the trigeminal nerve, the fifth cranial nerve. And in the brain there will be hypothalamus, and hypothalamus will be overactivated. Means it will activate the sympathetic activations. All kind of sympathetic means stress and fight and flight movement will be activated. And the hypothalamus will release the CRH, that is corticotropic releasing hormone. Corticotropic releasing hormone. If this corticotropic release hormone once released from hypothalamus, it will stimulate the anterior pituitary gland. The anterior, there are pituitary having two anterior as well as posterior. The anterior pituitary gland will be activated and it will be releasing ACTH, adrenocorticotropic hormone. Adrenocorticotropic hormone. Once adrenocorticotropic hormone releases, it will work on the kidney medulla where there is a adrenal glands located, adrenal glands, and will help to release cortisol. Cortisol is called as one stress related hormone. When you are stressed, this hormone will be released. Means your body is not comfortable to face that situations, then only release these things. It may be by looking a snake, by looking a dog, or by looking teachers like me. If you look at teachers, if you look some odd situation which is not favorable to you, you will feel stress, anxious by releasing of cortisol. They are interconnected. After coming stress, this will release, or as they release Cortisol will release, stress will induce more. So it's called stress related hormone. So the sympathetic domain will induce to release cortisol by through this pathway. This pathway called as the hypothalamus pituitary adrenal axis. Hypothalamus is the hypothalamus, pituitary is the pituitary gland, and axis means this total channel called as the and obviously A stands for the adrenal gland, and axis means the whole one. So this practice will increase this kind of access. Okay, but there is again thing, this stress is good, which called the essential stress. Okay, essential stress is good for any kind of active work. If you have exam, you should be stressed out, or you should be alert more. If you're walking on the night, no one is there, you should be alert. Why this alertness coming? Because hypothalamus releasing so and so, and the cortisol is releasing little bit up to one extent. Yes, if it is releasing up to one extent, is good. If it is going very up cortisol level, then the person will develop the excess, the huge stress. It's called as the secondary stress, which is not good for any people. That should not happen. By practicing yoga, the stress should get decreased actually. But initial stage when you are not able to perform, that time stress will go up. That should happen. That's why Yoga Sutra says in terms of asana also, prayatna shaithilya ananta samapatibhyam. The prayatna effort must be there, but the effort should get down day by day. In the essential state, their effort or the stress should be there. Day by day continuous practice, like dirgha kala nainyantarya and many things they explains. By continuous practice, the stress should get down. Then only it shows you are a good practitioner. So by practice of Sūryabhedana Prāṇāyāma, this axis, hypothalamus pituitary adrenal axis, will be activated. So the person having this stress, he should not go for this practice. If a person have depressed state, he should go for this practice. The person who is anxious, he should not go for this practice, isn't it? We'll be talking those part later on. Let's understand this. Hope this point is clear. How does it work on the neuroendocrine function? Now let's understand the yogic approach, textual benefit what they explain. This Kapala, Pranayama, Sūryabhedana Prāṇāyāma, what it does is Kapala Shodhanam, Vata Dosha Gnam, and Krimidasa Hrit. Hrit means Hananam, destroy, elimination. So elimination of what? Kapala Shodhanam. The Kapala means the skull area, whatever the skull area we have. That will be Shodhanam, Suddhi will be done. The purification of the skull area. How does it happen? We know in yogic term this says Vata present below your thighs, Kapha present above your chest, and the Pitta present the middle part, the Madhyasthana. So Kapala means the upper chest. There is a chance for the Kapha predominancy. So that by practicing the Kapala, by practicing Sūryabhedana Prāṇāyāma, heat will be generated more in your body. Heat means I am talking about the biochemical heat. Biochemical heat will be generated in your body, like by activation of the heart rate, by activation of cardiac output, and so on. All these things we know, by the over depolarization of the cardiac muscles. So that Kapala by heat will be generated. By that what will happen? Kapala, the skull area. Skull area means we have the four cavity, ethmoid cavity, maxillary cavity, sphenoid, and all these four cavities are there. They are called the air-filled area, air-filled cavity. If there is any deposition of Kapha, Kapha means the infections might be there, or any kind of infections will be there, or any kind of storage of Kapha doshadi will be stored. If you practice this Sūryabhedana Prāṇāyāma by generating heat, continuous practice by stimulating this sympathetic activation, that Kapha dosha or Kapala will be pure, or it will get purified. Okay. Or any kind of dosha which is leads to the dullness. It means tamoguna related. In yoga we call as a tamoguna. Tamoguna is all about the passive state. Sattoguna is normal state. Rajoguna is overactive, and the tamoguna is called passive state. Means in a depression state. Okay, depression means it's not psychologically, physiologically called as depressed, means called what do you call laziness. The person is not alert to do any work, laziness, obese. So all such things connected to the tamoguna. And the tamoguna, that if it is there in your body, that Kapala means the buddhi will be improved. The skull area connected to all kind of calculative mind. Okay, so cranial part. It's all kind of the activation, memory power, buddhi, thinking, reasoning capacity. Kapala Shodhanam means unwanted thoughts will get perished, will be destroyed. Kapala means the skull area. It's not about the Kapala, not only stands for the physical, what you can see that Kapala. It's all about the spiritual practice also. The Gunadi means Tamoguna will decrease. Okay. At the same time, it will induce some other activity. So if you have the problem regarding the headache, or if you have the sinusitis, such problem can be targeted by practice of Sūryabhedana Prāṇāyāma. That is explained here, Kapala Shodhanam. Vāta dosha gham. If the pitta goes up, automatically Kapha as well as Vata will go down. We have the three humors in your body. Three dosha, we say Vata, Pitta, Kapha. So by this practice means overactivation of the heat is connected to Pitta Guna. If the Pitta goes up, automatically Kapha means Kapha related issue, whatever the Kapha problem we are having. Many problems we have the Kapha related, 20 types of problem we know. Pitta related we have almost 40 problems, and Vata related we have more than 80 problems. So those problems will be decreased. Remember, if a person having Pitta problem, if you teach him this particular Sūryabhedana, he may increase the Pitta problem, indigestions or gastritis, peptic ulcers, so and so. That will induce more. How it will induce more? Or the gastric juices will be overactivated and they will make some game in your body. Maybe gastrin will be there, or HCl, hydrochloric acid, they will release overactive. Why they are releasing excessively? Reason is stimulation from the sympathetic domain. We have the vagus nerve. Vagus nerves will come and will stimulate the stomach. We know this is stomach. Stomach will be activated by stimulation of the vagus nerve, the longest nerve. Okay, so that should not happen. So Vata dosha ghram means the Vata dosha adi. It may be some kind of gastritis. Gastritis is also connected to the Vata as well as Pitta related problem. Vata Pittaja dosha. So that will be decreased here. Again, we should call as the Chitta Vishranti Karakam. If the Vata dosha gets decreased, means the unwanted neural activity. One neuron is connected to the other neurons. The cell body, they are interconnected. If unwanted neural conduction got decreased, so what will happen? The thought process will be decreased. That is a state of called Chitta Vishranti Karakam. And we know the second sutra, second sloka in Haṭha Yoga Pradīpikā, what this says, second chapter, Chalayvata Chalam Chittam. If your Vata gets stabilized, Vata doshas, here they would use Vata dosha, physiological. Okay, if that gets stabilized, automatically your body movement, unwanted movement, that will affects on your mental status, psychological status, that also will get decreased. So the Chitta Vritti will get down. So that is the intention of yogic approach, what they are talking about. So Vata dosha gnam. So Vata also will get decreased. Remember, the person having the Pitta dosha more, he should not go for more over practice of this particular practice, because it's already inducing Pitta guna, Pitta quality. The person having the Rajaguna in him, he should not go for much more practice, limited practice. That's why we call as Yatha Shakti, Guru Padishta Margena. How Guru explains, in the same way he should practice. Okay. Next is here, Krimi dosha Haṭha. Krimi dosha means it may be any kind of worms, microbes, or any kind of infections which is located in your GIT tract or any part of on the screen, means it may be some fungi, or it may be in your intestine, or in your GIT tract, anywhere it may be there. Krimi dosha means krimis all times they produce during the cold exposure, cold. And in case of this practice, we will generate more heat. And how it will produce it, we already discussed. By that, what will happen? By this production of the biochemical heat, this will create a not so good weather, not so good environment to growth of this kind of krimi adi. That's why you have seen the krimi worms will be there in the small age, when the boy will be little, small age, maybe up to 8-9 years. In Ayurveda, they believes the childhood, there will be Kapha predominancy more will be there, and during the adulthood, there will be Pitta predominancy, and in the later age means in the later age, means after 50 or after 60, there will be predominancy of Vata. These 3 points, 1, 2 and 3 points. So creamy will happen all times due to the Kapha exposure more. So childhood. So most of the creamy problems connected to the childhood problem, Kaphadi problem. That's why you see in a small baby, they will be sneezing, naak ka behna. And adulthood, they will be having more indigestion problems, they will be having pimples and gastritis problem, okay, IBS problem and so. And if the person getting age 60 plus, they will start some joint pain, bennu pain means the pain in the backbone and so and so. घुटने का दर्द, पैर का दर्द, हाथ का दर्द, okay, supine का दर्द, सब चीज का दर्द, pain will be started at this time. So that's why they told here, krimi dosha hrita. Krimi dosha means the problem regarding the kapha targeting. Obviously, kapha is decreasing here, so there is no chance for kapha related problem. Bath also decreasing, there is no chance for the joint pain and so and so. And at the same time, kapha also getting purified. So overall, this practice is one of the great practice to achieve good health. Hope this notes getting clear to your mind. In next point, we will be discussing who can practice and who cannot practice Sūryabhedana Prāṇāyāma. Hope it's clear to you.